The Institute for the Study of Peak States presents the 6th International Psychoimmunology and Psychobiology Research Symposium. This video, Pay for Results, by Dr. Grant McFetridge.
Okay.
Okay, so our next speaker is Dr. Grant McFetridge. He's the founder of the Institute. He originally worked in electrical engineering and R&D as a consultant and adjunct faculty in California. In 1998, he founded the Institute for the Study of Peak States, where he focused on research. He is the author of many books, including Subcellular Psychobiology, Diagnosis Handbook, Silence the Voices, Peak States of Consciousness Volume 1 and 2, and the Wholehearted Healing Manual. Today he's going to talk about Pay for Results, what it is, and how to use it in your practice. Over to you, Grant.
All right. Thank you. All right. Well, this is a subject that I feel very strongly about, and I'm glad I have the opportunity to talk about it today. Just go next. All right. Did the slide change?
Yes.
Excellent. Thanks, guys. Okay. So when I thought about writing this talk, I came up with certain things that I've seen over the years that might be very helpful. And these are the topics that I'd like to express. Now, because it is such a serious topic, I thought I'd lighten it up a little bit with these little headings, as you see. So the first one is, this is not a guarantee. Okay, what is pay for the results? Well, if you go online and ask the AI, this is sort of what you're going to get. Pay for results is a payment model where clients only pay for the therapy if achieve specific outcomes that are predefined by the client and the therapist. This is very different than traditional hourly billing, where the client gets charged no matter what happens. So that means if the goal is achieved that you've predefined with your therapist and client together, the therapist gets paid. And if the criteria aren't met, then it's free. So the client doesn't have to pay for failure. And this has a huge impact in people's practices and the client's experience of the therapy itself. Okay, so pay for results applies to pretty much all client interactions. You figure out ahead of time what you're trying to accomplish, and you figure out how much it's going to charge, and then you come to an agreement with your client. All that sounds like it's very difficult, but honestly, it's very fast. You have to diagnose the client anyway, and so this just becomes part of that normal diagnosis. It takes only a couple more minutes than you normally spend. This also recognizes, pay for results, also recognizes that you can't always help the client. There's going to be some people you don't have the expertise for, you don't have the tools for, you don't have the experience for. And this model recognizes that and accounts for it. And so when you do end up setting a fee, the fee covers the fact that there's going to be some people that you just can't help. Now, notice, if you're a therapist, that the financial incentive is not to try and hang on to a client even if you can't help them. Instead, your financial incentive is to pass them on to someone else as quickly as possible who can help them. And this changes a therapist's interactions from some sort of, oh, I need this client to make money, into let's work together to get this person as well as possible. Okay. So again, this is a client-centric model instead of a therapist-centric model. It also definitely encourages the therapist to get really good at healing clients, because you don't get paid unless you succeed. Again, I should say that the current model actually rewards failure. and and that's what kind of what we see in the marketplace. Um, so if you only get paid if you succeed, a therapist is going to be spending time improving their skills and finding therapies that work better. It also has another interesting result. It encourages a focus on specializations because if you specialize, you can get really good. You start to acquire the tools that really matter, and and you can make a difference, a huge difference with your clients. It turns out specialization is also a better way to get happy clients and more clients. Okay. This also resolves suppressed ethical considerations. So, at some level, if you're getting paid for failure and you know that the client is actually maybe financially suffering and is struggling to pay you, and then has to go somewhere else to try and get paid, that just feels wrong, at least to me. And by doing pay for results, I think it's a cleaner ethical feeling both to the client and to the therapist. And finally, it eliminates client disputes. You have set up terms right at the beginning that says, I'm going to get paid for doing such and so, and if I succeed, and you go from there. There, sometimes the vagueness of just chatting with your clients ends to misunderstandings, and the client is actually hoping to get healed. And this makes it really clear to the client that what you can and maybe you can't do. Okay. It also simplifies advertising. What do I mean by that? If you're a therapist, um, and we see this all the time, you advertise you're a such and so therapist and you've trained in such and such a modality and so on and so forth. But you leave the clients trying to struggle to find out if whatever you're talking about is relevant to their disease so that they can take a chance on paying you to get well. But now, instead, your focus is on the outcomes, not your certifications, not your trainings, any of that sort of stuff. And just as an aside, I've seen this a lot in therapists I've trained. They're so used to describing or explaining what their trainings are, they don't realize that most clients don't care. The client is just has a problem and they want it fixed, and they prefer to treat you like their tax attorney. Just let's just pay, let's get well, and let's just go on with our life. It's an interesting psychological dynamic. And finally, pay for results really encourages innovations. Um, the more success you have, the more new treatments that you have that work, the better you're going to be paid. So that's the basic benefits for pay for results. It's sort of an overview. So let's get looking into some specifics. Okay. So in this one, even my grocery store uses pay for results. Okay, so pay for results is standard in many, many, many industries. And it's very interesting that in medicine and in psychology, it's almost unheard of. And yet it's everywhere in the world. So what would be some examples of it? And I'd say, as you've seen right there, your grocery store. If you went into a grocery store and bought a bag of potatoes and half of them were rotten, how would you feel? You expect every potato in that bag to be attractive and nourishing. And if it isn't, the agreement with the unwritten agreement with your grocer has been violated. So really, everything you buy in the grocery store has a pay for results contract in it. You just don't actually sign a piece of paper and say it. It's just assumed. Okay, let's look at getting your car repaired. If you go to a dealership, they'll often quote a fixed price right at the beginning for whatever problem you have. I think we've all had the experience of taking our cars somewhere else to some garage or other and finding out the cost is astronomical and it wasn't anything we anticipated. And Essentially, that's the difference between a pay for results and just a value added contract, like you're some sort of government contractor. Okay, performance contracts between companies and their suppliers, another example of pay for results. Engineering consulting, you don't get paid unless you succeed. Salaried employees, oh, we don't tend to think of it this way. The employees in a salary are expected to produce. And if they don't produce, they're essentially let go. So it's really a performance-based metric, not an hour-based metric. And again, like I said before, it was it's oddly not common in medicine and psychology. Okay, so I'm going to repeat that bias I have. As Shane mentioned, I started my career in electrical engineering, and in the field of engineering, pay for results is completely normal. Everyone uses it, everyone knows it. It's basically baked into the DNA. And when I shifted to psychology, I was really surprised that it was just an unknown concept. So let's just continue on here. Okay, so let the screaming begin. So since I was the founder of the Institute, I felt, and especially because we were um, coming up with treatments that had never been done before and didn't always work. This was very new in the early days. I felt it was just completely unethical to charge people for failure because, these things were new, they may or may not work. We're still getting the bugs out. And so pay for results was normal. But that was very difficult for the people I was working with to accept. Finally, by 2007, I just made the fiat thing that we would move into pay for results for everything we did from then on. And it was very interesting. About half the people that I worked with at the point just quit. They weren't willing to make that a transition into paying for results. Now, we'll talk about the reasons for that, but in 2007, that's when the Institute went fully into a pay for results modality. Okay. Since then, so it's been many, many years, our certified therapists all agree to use pay for results. So you have that kind of level of integrity and directness from people who are certified by us. And as you can see in there, we also train a lot more therapists than just the ones who become certified. Certification is a pain in the butt. And so you have to put a lot of effort into it to do that. Most therapists don't get certified by us, which is perfectly fine and acceptable. Although I hope that they would certainly consider going to a pay for results model in their work. Okay, so as I said, there was a lot of drama in the Institute when I enforced the pay for results agreement. So what were the reasons? I think money fears is one of the biggest ones. Many, many private therapists are struggle to make enough money, and they've just felt that if they did a pay for results agreement, that they wouldn't make enough money. So that's one fear that people have. Whether it's a reasonable fear or not is a completely different issue. The second is poor techniques. If you think back in the 30s, the 40s, the 50s, the 60s, psychotherapy was not very effective. It hasn't really been to the 90s that effective psychotherapies have appeared and become used. And so the field in a lot of ways has changed a lot. Now a client can expect to become well, whether it's using techniques that we've developed or other techniques that are in the field. It's a very different picture. And unfortunately, the whole field hasn't really shifted into that understanding that now we can make a difference. There's so many good ways to get rid of post-traumatic stress disorder, for example. And just as a pet peeve, many, many schools don't teach the good ways. And that's Uh, I'm getting smiles from some of my colleagues here in the room. Um, I've not quite figured out why that's the case, but it certainly is. Many therapists have to leave school and get training outside of their own academic institutions to learn the latest generation of very effective trauma therapies. And finally, therapist socialization. Everybody is doing it, and so people just assume it's normal. It takes someone like myself who comes from a completely different field to go, wait a minute, what's going on here? Why isn't anyone doing this? Uh, yeah. I'll give you another example just from a personal story. Yeah. It's- Let me just check on my time here. Oh, good. I'm only halfway. Um, when I was a therapy student, so I was in my PhD program in psychology, um, the most depressing weekend I've ever probably experienced was when I went with five or six people who graduated and had their own clinics in San Francisco, and we all went on a ski trip together. And in that ski trip, um, in the evenings, we were sitting around and they were all talking about how nothing they did worked or mattered. And yet they couldn't quite say that out, but you could see that was really what was going on and how depressed they were um, and kind of hopeless about it. Very, very depressing weekend. And fortunately, the tools are much better than they were back in the early 1990s, as during my training. Okay. Okay, back to confusion. Um, what happens when you say, we're going to do a pay for results billing? Sometimes with clients, they get confused. They haven't seen this before. They didn't expect it. And and you can look at their eyes and they kind of get glazed. They haven't heard the phrase pay for results and they get confused. So they think, is this a guarantee? What is this? Or their brains just shut off. And so you have to account for this when you're talking to people and explain what's going on. This applies both to the clients and to therapists. And for example, Shane was working with a therapy clinic, and everything was going really well. We were looking at having some sort of relationship. And after a week or two, pay for results came up, and suddenly they wanted nothing to do with us or with Shane. Um, I'm not exactly sure why, but the whole idea of results just caused them to stop any interactions with us. Once, just jumping forward, pay for results is completely legal. In the years when I said that it's time to start using this, I had a lot of therapists say, "Well, no, can't do that. It's illegal." Well, it's completely legal. People were just coming up with excuses to not change. And yeah, that's just human nature, I guess. And I should point out that pay for results would be awesome if there's any insurance companies listening out there. Uh, I can imagine that CEOs of insurance companies would just jump up and down in joy if they knew that pay for results was even an option in therapy and medicine. And finally, with uh, pay for results, it's kind of independent of a bigger problem in therapy, and that's client flow. Do you have enough clients in your treatment, and can you help them? Is really a bigger issue, and people confuse pay for results with that underlying client flow issue. Now, if you work for a clinic where there's already people coming in, it's a completely different situation. But for private therapists, that's often one of the reasons why they're a little panicked about pay for results. Okay. Um, let's see. But I won't know how much to charge. That was another issue for a lot of people who are worried about therapists who are worried about pay for results. Um, as everyone knows, the current model is a charging per hour, kind of like you're some kind of mechanic in a garage. And whether it's $100 or $50 or $150, that's the standard model, and that's what most people know. Well, with pay for results, you don't get paid if you don't succeed, and you have to tell the client ahead of time in the beginning what it's going to cost them. So there's no surprises. They don't find out after therapy's over that they have to mortgage their child and sell their wife to cover the costs of the bill. Instead, they walk into the therapy knowing that this is going to be what it'll cost, and they can make a decision where it is worth it or not to them. Okay. Yeah, so as I wrote here, you're not some dodgy car repair place who just jacks the price up, nor are you some sort of cost overrun government contractor. It's a fee, and everybody knows what it is uh, ahead of it. Okay, you should also define what happens if the client quits before the end of treatment. And finally, again, you recognize that you won't always succeed, and you just build that into your pricing. So you adjust your prices to cover the percentage of clients that you can predict that you won't be able to help. Now, how do you know how many you won't be able to help? Well, new therapists who are using these tools can basically find out after they've worked with 5 or 10 clients, and they start to get a feel for how many they can help, how many they can't help, and they start to be able to spot the ones that they know their experience won't allow them to solve the problem. Okay, so you just build that into your pricing structure. Now, what we find in practice is that if you're doing general therapy, most therapists simply have a set fee. And they can set, they could, because they kind of figure it's going to take 2 to 3 sessions to do whatever they're doing. And at that point, they'll really know whether they can help them or they can't. And so a set fee actually works really well. And it's easy. You just say, yeah, you have this, it's $500. You have that, it's $500. Obviously, you can adjust your prices depending on if you know based on experience, it's going to be harder or easier, but that's basically how easy pay for results is. Now, you can compute optimum fees, and on our website, we actually give the math so you can compute it if you want, but most people don't bother. And finally, if you have a specialized treatment, say ADD or voices or obsessive compulsive disorder or any of these other disorders, you can actually set a fee that you think is reasonable based on both can they get treated elsewhere and also and the rarity of treatment. So yeah, for that, often we set a fee that's quite a bit higher, say, depending on what the disease is. Okay, finally, and this is the one that a lot of therapists are really terrified about is, can I write a good contract? Now, it turns out writing a good contract is very easy. But again, it's an experience thing. They haven't done it. It's not part of their academic environment or work environment. And so we'll just go through some of these writing contracts issues that therapists worry about. Believe me, once you've done this, I don't know, 5, 6 times, it starts to get really easy. You write boilerplate and you just fill in little blanks. So let's take a look. So the first thing is it's a mutual agreement. You have to write down what you think you can heal, and they have to tell you what they want healed, and then you come to an agreement on what's the intersection of those two things. The next thing is you only say that you're going to fix 1 or 2 things, only going to have 1 or 2 outcomes, because if you have more than that, statistics say that you are going to fail somewhere and then you lose the entire contract. So you just stay focused on 1 or 2 things that the client really needs that you think you can offer. Okay. The next thing is when you write the contract, it's based on client symptoms. Okay. And I'm going to talk about that on how to screw this up shortly, but essentially you work off symptoms. You don't work off of theory. You don't work off of models. You don't work off of, I think this is what it is. No, you start with symptoms because that's what they're paying you to get rid of. And finally, as you write a contract, you make sure it's testable. So that's where some thought has to be taken by therapists. But again, with practice, it becomes second nature. You want to be able to test whatever it is you're trying to treat right in your office. And for people who've taken our training, testable is second nature. You work with symptoms with the clients. So that's what you're actually doing, finding from the client, and then figuring out what you have to heal from there. So just in your evaluation, you work with symptoms and they roll right into the contract. Nothing special is needed. Okay. Now, what's the apex problem? This is one reason why um, a contract, a pay for results contract, is so bloody valuable. And I think I have 3 minutes left, so I'm not sure I have time to go into a story, but I'll just briefly say that one of the first people I ever treated was a friend of mine who was attracted to unavailable women. He'd been moaning about it for years, and after we healed it using wholehearted healing, I was all excited to find out how he felt the next couple of days later. And he looked at me and he said, "What do you mean? My issue isn't I'm attracted to unavailable women. It's that I'm broke." Well, what he'd experienced was the apex problem, where you've healed it so well, the client often forgets what the heck the problem was. If you write a contract, you can show them with a piece of paper that yes, they had a problem, and yes, it's now gone. Okay, and of course, on your contract, you just put the usual stuff about contacts and emergency and appointments and stuff like that. And the Institute, you can always go online and take a look. We have specific disease contracts for the different things, right, that you can download to see what the contract would be. Okay, here's an example of a pay for results contract. You see it's very informal, easy to do. You just fill in the blanks when you're working with your clients. If again, this is a general therapy contract. Again, I'm running a bit short on time. It's only 1 minute left, so I'm going to go a little quicker. Here's another one, again, written in a different way, but you can see these examples both online on our website and in the book Subcellular Psychobiology. Okay, here is one that comes right off of our website. This one is for a specific disorder. Okay, I'm just going to move forward. Okay, and I'm going to mention bad contracts because yeah, I'm getting thumbs up here. Bad contracts, it's untestable. In other words, this is the number one problem with contracts. You did not write down what the symptoms were and what you agreed to eliminate. Instead, you went into some academic thing. For example, we will restore your cognitive function back to what it was a year ago. Well, what does that even mean? And after you, can even anyone remember? So you have to work testable things that you can put in the contract. The second thing is too large in scope. Well, one mistake is you write too many things down. I'll fix X and Y and Z, and then do unrealistic stuff like and this is just kind of silly, but marrying a supermodel. And finally, a lot of their clients come in and they're like 57 Chevys. They're rusty. They got smoke coming out of the tailpipe. Parts have fallen off. And if you ask them, well, what's wrong? The list will take the whole therapy session. So instead, you have to be focused and say, what are you here and to pay money for? What is your real issue? What is the thing that's important? And that's a mistake that a lot of therapists make because their training really isn't designed for that. Okay. The other thing is delayed outcomes. You really want to focus on stuff you can check in your office. Now, occasionally you might have to wait but you can often just use a regression, for example, to a traumatic moment to check your work. And finally, the problem of unnecessary treatments. You and the client are working out, they're paying hard money for help. And they're there because they have something that's really important to them. You want to stay focused on what's needed by them. It's a client-centric approach, pay for results. Okay. And finally, the recap. This is the end of the talk. We're just about done. The golden rule from Christianity says you want to treat others like you would like to be treated yourself. Pay for results agreements and clear expectations from your therapy and are ethically satisfying and very simple to do. We want to be treated in the same way we want to treat others. The golden rule here. So pay for results is it's just ethically satisfying and it's easy to do. And most of the world embraces it in their practice, whatever business that they're in, whether it's explicitly or implicitly. Okay. So you can learn more. Again, go to our website or the book, Subcellular Psychobiology Diagnostic Handbook, has a chapter and 2 appendices on it. But again, that's all duplicated on the website. You could just read it. And finally, here's some of the textbooks that we have printed. And I think I'm out of questions, so we'll save that for the end of the seminar, symposium, excuse me. Okay.
Thank you for watching. For more information, please visit our website www.peakstates.com.